The reason I'm glad you're here, this indicates to me, and to anybody who's here, that you have an interest in the topic. There's a good chance I know why you have an interest in this topic. And I don't think there's anything a parent can do for their child who does have ADHD that's more heroic than learning more about the disorder and trying to really get an understanding. And I'll try to say more about that in a minute. But let's start with what in my head I think of as the target effect. So let's kind of walk through this scenario very quickly. And you can kind of change the facts a little bit, to fit your situation. Sunday night at your house, and one of your children says, "Hey, I wonder if Target's open." And you say, "Why do you ask?" And they say, "Well, I need a poster board, and I need some glue, maybe some string. I need maybe some big mark." They go through a laundry list of things. And "Why do you need those things?" And they say, "Well, I got to make a map of Western Europe. I got to do different colors on it, and I got to get all the capitals on it." And so you ask what question at this point? When is this due? And the answer is tomorrow. And then you say, "What's your next?" Tomorrow. And then you say, "What's your next question?" How long have you known that this was due tomorrow? And they say, "I don't know." Right? And you might say, "How many times have I told you this? You need to stop procrastinating." And you kind of fuss, and everybody gets sweaty and irritable with each other, and you're up late working on this thing, and you're mad, and they're upset and embarrassed and ashamed. And I've walked through this scenario with hundreds and hundreds of people now. Most people in the room go, "Ooh, yeah, right," like this. And part of my motivation for telling that story is two things. One is to point out that ADHD is a much more complicated disorder than just having trouble paying attention or maybe being hyperactive, because neither one of those has anything to do with focus and attention, or really with hyperactivity. It has to, in this case, it probably has something to do with the fact that we think people with ADHD have trouble with time, but not just because they're procrastinators. I procrastinate. Procrastination means you're on an airplane from Ireland and you think, I really got to do that talk. You know what I mean? knowing when it is, how much time I have. If I just decide not to prepare enough in advance, that's procrastination. If I have trouble really grasping sort of how time flows and the fact that I've got to organize my behavior across that timeline to get things done, that's not procrastination. And furthermore, it's not going to help me to have people fuss at me about it, or to think of it as something that's a character flaw, or that I'm somehow, if I'm a parent, that I've somehow failed my child, not helping him learn by telling them over and over again that they have to stop procrastinating. Well, that's not the problem, right? So when we learn more about the disorder as adults, then we frankly gain more sort of empathy, understanding, and it can help us get away from some of that parent stuff that our parents did to us, of saying how many times I told you and so forth. So that's what I mean when I say that trying to learn more about the disorder is I think the most heroic thing we can do about it, because there's no greater blessing in the life of a child who has ADHD than to have people around them who kind of get it, kind of understand what the disorder is all about. If you stop people down here at a shopping area, just with a clipboard, you're doing a survey, and you stopped them and you said, "Have you heard of ADHD?" Everybody you stop is going to say yes. And then if you ask them, "What is ADHD?" they're going to say something like, "Well, it's kids who have trouble paying attention, and some of them are hyperactive." And that may be kind of the extent to which most people are familiar with ADHD. And as a result of that, I think we miss providing these kids with a lot of what they really do need. So anyway, and we get ourselves in this situation as parents Like, I want my child to not have to take medication. Totally understandable, you know. And then we're hearing from other people, and we might be hearing from some people, you know, medication's a great thing, can be very helpful. And other people might be saying, oh, you know, those medications are dangerous because my aunt Gladys, who lives in Atlanta, her first cousin in Montana had a next door neighbor's child who took the medication. And I heard that when he took the medication, his eyeballs popped out of his head and just rolled down the sidewalk, you know, or some kind of thing. So, you know, you're confused about all of that. And then, you know, you need help with managing the child's behavior, but trying to find people that can help you learn how to do that is extremely difficult. So, and for most people, frankly, impossible. One of the arguments I've been making in public a lot in the last several years is that most children who have ADHD are not really going to get all the help they need. Not even in a community like Vestavia, where I live here, or Mountain Brook, anywhere else. Not to mention children who live, say, 50 miles west of Montgomery, who are not going to get the treatment they need for, you know, what can be a really significant disorder that, you know, can have a profound effect on people's lives. Let me get off my high horse briefly, at least. So what is it? Let's say more about it and kind of expand on this. Of course, we know that ADHD has something to do with focus and attention, or deficits in that area. But I'm going to say more about that in a minute to kind of help us all get an idea of the nuances of that. It's not that simple, all right? It's true, but not that simple. We know that one way to think about this is the hyperactivity most of us have seen or that live with or know something about, it's also a little bit more complicated than we think of. So we tend to think of this issue with ADHD, which is not always present. I think most people know there's a kind of a classic variety of ADHD, you know, where you have focus and attention problems and you have, you know, hyperactivity, quote unquote. And then we probably know that there's also some kids out there that seem to have clinically significant problems of focus and attention, but don't really have the hyperactivity. And what we think impulsivity, being impulsive and being hyperactive, are roughly the same thing. In fact, hyperactivity may be sort of driven by problems with impulse control. If I've got ADHD, and frankly, check with my wife, there's some dispute about this. I don't think I do. But if I do, and I'm standing around someplace, and I see something interesting walk by, I'm going to jump up and pursue it without thinking if I'd be jumping up and pursuing it. That's impulsive, right? Or if I blurt something out without thinking it through, that's a kind of almost like verbal impulsivity that can kind of look like verbal hyperactivity almost. So it's a little bit more complicated. There's something a lot fewer people have thought about or know about is that we think now that people with ADHD, kids, have trouble regulating their emotions when they have ADHD. And then there are all kinds of other problems associated with ADHD, including, like, for instance, the time target effect that I was talking about earlier. By the way, I sometimes call that the CBS effect, same difference, right? So the core deficits, and we think, and for most kids with ADHD, are problems with some kind of problems with attention, trouble with impulsivity, hyperactivity, and then emotional regulation. Now, what these two common types, you know, formally they're called ADHD combined type, the second one, if they have both the focus and attention problems and the hyperactivity and impulsivity problems. If they just really struggle with focus and attention, but aren't particularly hyperactive or impulsive, those your doctor, when they diagnose your child, will call ADHD. It's still got the H in the name, but it's ADHD predominantly inattentive type. It's perfectly okay, though, for people to think that's ADD instead of ADHD or whatever, you know. What doctors call it's not that significant. So inattention, impulsivity, hyperactivity, emotional regulation. Now, just a word about the kids who have the non-hyperactive ADD variety of this. We don't know as much about these folks as we'd like to because the studies are not as abundant as they are with combined type. But here's a list of kind of things that might look familiar to you if this is something you're dealing with. These kids are more prone to be kind of shy, maybe a little bit reticent socially, maybe a little bit withdrawn, not necessarily clinically withdrawn, but kind of withdrawn. They are not likely at all to be hyperactive. In fact, they may seem just kind of daydreamy, and they might be kind of sluggish. Now, sluggishness here has nothing to do with intelligence. It just has to do with the speed at which people get things done. So just, it takes might take this kid, until next election day to get one-page math problems done. Not because they can't do it, but because they can't stay with it and have kind of a sluggish tempo to their activity. They're poorly organized. I still remember a patient of mine, the parents brought him in, and before I met the child, I met the parents first, parents said, kind of made their case that they thought the child had ADD, and then they said, now she's very organized. And in my head, I thought, doesn't have ADHD. That's not fair. That's kind of an exaggeration. It would have been possible for example, to have ADD and also obsessive compulsive disorder. But organization, trouble organization is almost kind of part and parcel to the disorder. It's kind of hard to have it and not be disorganized. But these kids also tend to be kind of passive in school. They're not up in people's face. They're not having to go to the office all the time for disciplinary issues. And actually, sadly, the fact that these kids, the ones that are not hyperactive, don't generally have a lot of behavior problems, which reduces the chances that they'll get diagnosed. Because a lot of times it's kind of trouble, the frequent flyer to the assistant principal's office kind of kid. That's what gets them kind of identified and maybe, get people motivated to get them evaluated and so forth. So that's an unfortunate kind of deal. Not aggressive as a group. They may be a little bit more prone to get anxious and maybe a little bit more prone to get depressed. If their parents are stressed out, it's usually because of academics more than it is behavior. Why can't I get this kid to get going? Sort of thing. Actually, their symptoms may slightly increase with age. The symptoms of classic ADHD have a tendency to get somewhat better with age, as a general rule, but not necessarily with these kids. And as I said earlier, later diagnosis is more common. I don't make much of the gender differences in these diagnoses because sometimes you don't know whether they're real or more about just how we feel about how boys and girls ought to behave. But generally, we think of classic ADHD getting diagnosed more in males, somewhat than females, and then maybe flipping it. But I don't think that's a reliable finding, to be honest. So let's talk about the attention thing. So we're going to kind of drill down on this a little bit. As a rule, people who have ADHD don't have trouble paying attention. Now, this is a little bit of a language trick, right? But they have trouble persisting with attention. So, all right, Dale, why are you making such a deal out of this? Well, it is kind of a deal. Let's say you have a fourth grade classroom, and you got Jeff here, and you got Kyle here. And Jeff has got ADD, and Kyle, he don't have the ADD. There's a lot of it going around, but he don't have it. So Jeff's got it, Kyle doesn't have it. And so Jeff and Kyle both get a page of math problems put on their desk. It may be that Jeff and Kyle will both go, whoo, here we go, math problems. And they'll start paying attention to it, right? Pretty much look the same. Jeff's got the disorder. So after some period of time, Jeff is like, whoo, he's off task. Kyle is still on task. So the difference is not in the initial paying attention to something, but it's about maintaining attention. Particularly if what you're asking them to pay attention to, and this is critical, is not inherently interesting, right? Which is a lot of school. I mean, let's just be honest, right? A lot of school is fun and exciting. It's a lot of desire to do this stuff. I don't really like it. So another way of illustrating this, I'll use a personal example, which again is predicated on the idea that I don't have ADD. But here's something I don't like. I don't like personal finance. I've run for money my whole life, scares me to death. But I keep up, I pay my bills, I do my taxes, I'm responsible financially, even though I don't like it. I pay enough attention and stay with it enough to get it done, even though I don't like it, because I don't have ADD. If I had ADD, I might say to myself, I really got to work on paying my bills. I really got to get my taxes done, but somehow I just don't, or I'll start it and not stop it, or I'm too disorganized to get it done, right? So the quality of what they're paying attention to ends up being super important, because people confuse this all the time. And here's how this gets manifest. I've heard this so many times. Dr. Wisely, there ain't nothing wrong with my boy's attention span. Watch him play with his Legos. He played with his Legos all day and all night, building castles and everything. If he can pay attention to that, then there's nothing wrong with his attention span. Or, whatever, or video games. That's the worst one. He played video games all day. Paying attention and focusing on a highly stimulating, interactive video game has nothing in common with paying attention to a teacher drone on about social studies. It's not even the same universe, right? But what happens is we basically sometimes catch a kid paying attention to something and then hold it against them for the rest of their lives. By not acknowledging that there may be something to the fact they can't pay attention to stuff in school, right? So the idea that they have ADD, they can't pay attention to anything is just wrong. And on a serious note, it's a cause of many kids never getting diagnosed. They get caught paying attention to something. Everybody says, "Whoop, nothing wrong there." I love to tell a story about a family from Walker County. And these great people, they had 4 boys, all of whom had terrible ADHD. And the father came in one time and said, "Hey, I found out something you can do to really keep these boys occupied." He says, "We got them a tater peeler. You put the potato on a spindle and you turn a crank and it peels the potato." He says you need a tater twister and a 20-pound bag of taters. And that'll keep them busy all day. And he said, if they do that all day, why can't they pay attention to social studies? Because listening to social studies doesn't involve this great cranking, potato peels going all over the kitchen, which is, well, maybe it ought to be about that. Social studies ought to be about potato peels going, I'm sorry. Okay, so they have trouble staying with something, right? And then they are distracted. But even that, y'all, is confusing. So right now, let's say 8 fire trucks just goes blaring by here right now. All of us would be distracted, right? It's like, what is going on? We would all, you'd all stop listening to me for a little bit. And then most of you, once the fire trucks are going, would be able to pretty easily re-engage, kind of get back, with the program. Those of us that have ADHD, imagine this room was filled with 5th graders. How about the 2 or 3 kids who just cannot settle down? The fire trucks are gone. They're still thinking about it, talking about it, can't re-engage, right? They're distractible, but then they have trouble re-engaging after distractions hit. Or even, let's say there was a distant noise like an alarm right now, like bang. We might all be distracted and we'll say, okay, that's no big deal. You refocus. Maybe if we had ADD, we'd still be distracted by it, right? So it's again, much more subtle than that. Okay, working memory is often an impairment for kids with ADHD. And working memory, the way I think about working memory is kind of like a sketch pad in your head where you write down information internally long enough to act on it, but you don't need to store it. So if Dawn said to me, "Hey Dale, send me your PowerPoint slides later, just text it to me, and here's my phone number." I don't need to memorize, I couldn't memorize the phone number, and fortunately I don't need to. But I need to be able to hold it in my head. Okay, Dawn said 2055, to go over and act on it, maybe put it in my phone, and then I can let that go. It's almost like a little sketch pad, right? Working memory. that working memory tends to be weaker in kids with people with ADHD. So you think, okay, big deal. Let's think about school. So in school, let's say the teacher says, all right, everybody, let's do an exercise. A train leaves Indianapolis at 7 o'clock in the morning, and it's going to average 110 miles an hour, and it's going to go to Chicago, and Chicago is 238 miles, I'm making this up, 238 miles away. How long would it take? Right? Not only do you have to kind of know how to do the math, you've also got to be able to say, okay, the train left Indianapolis and went to Chicago, and the distance is 238 miles. And he says, you got to retain all that in your head long enough to act on it, even to get it down on paper. That's why with ADD, kids will say, it left where now? Okay, and then when did it leave? And you have to, because of a relative weakness in what we call working memory. Okay, so attention span, to kind of wrap this piece up, is often with kids who, let's just say, God knows they have ADHD. Their attention span is gonna be fine in some situations, particularly when those situations are highly motivating and highly interesting and interactive and those kinds of things. The question is, can they pay attention to the not necessarily interesting stuff that we all are supposed to pay attention to in order to be able to function? I'm going to move ahead a bit. I have a tendency to get behind. So let's talk about impulsivity and hyperactivity. Now, I sometimes make little silly jokes, but this is gravely serious. So it's potentially extremely serious for a person to be impulsive, because impulsivity, it means that we act, we do things, and we say things without sufficiently thinking them through. So I'm going to tell a couple stories, because not to scare people, but the goal here is to kind of help us all stay motivated to kind of do the best we can for our kids with ADHD. I worked for 14 years at Children's Hospital. I kind of ran a pediatric psychology program that we built. And so I have a patient of mine from Vestavia. This is long enough ago, I don't have to worry about, I'll disguise their identity, obviously. But their house was situated in a way that the child's bedroom was pretty high off the ground. And his habit was, this kid was, I think, 10, 11, and he had ADHD. And his habit in the summer was sometimes he would open his bedroom window, and there was something outside his window he could stand on, like a shade or, like a frame or something, so he could actually step out, at tree level, basically. And so one day he says, hey, there's a swimming pool. I'm big enough now that if I jump, I can make it in the pool. So he jumps and he lands about 1.5 feet short of the pool and breaks his femur. He had a compound fracture of the femur, nasty. He ended up being fine. So his mother calls me, tells me what happened. I go to see him in the hospital. He's in traction, with Tiro. I already know what's going on. But I just love this kid. We had a great relationship. And I said, oh, what happened to you? And he said, well, look, I know you already know what happened to me. I jumped trying to get into the pool. And what I want to tell you is that halfway down, I said, oh, okay, so this could have turned out worse, right? I mean, it could have turned out a lot worse. The other reason, pardon my French, that's a direct quote. But the reason I think the story is important to me is, A, he turned out to be fine, but halfway down. So after he got past the impulse, then he realized quickly. A friend of mine who does a lot of this kind of work, he says that he talks about verbal impulsivity a lot. And that's an interest of mine. So he says that the international salute of a person with ADHD is whoo, meaning they said something they immediately know they should have said, right? They kind of blurt things out. And so blurting things out is not necessarily in and of itself a bad thing. But I've seen, for example, teenagers, great kids with ADHD who blurted out something at a police officer and it not turned out very well. Or run away from a police officer. Had that happen once. Didn't turn out well. I'm talking about great kids. They were impulsive. They acted on impulse. So when we're walking around, all of us walking around every day, we're having to try to control our impulses. And that's how we are allowed to have civilization, right? By not stealing stuff, by not, you know. And so these kids are relatively weak. And so a tragic story, the second I'll tell, is a patient of mine. I'll do a shorter version. ADHD, another 10-year-old, he's at a church picnic, thunderstorm comes up, everybody hides from the storm under a pavilion. And then he's with his friends, pouring down rain, lightning and thunder, and he got to his friends, he says, yeah, and he runs out into the rain to impress his friends and was struck by lightning and killed. Now the cause of his death was a lightning strike, but a contributing cause of death was impulsive behavior. You know, he had this impulse to run out in the rain to impress his friends, and he was not able to say, oh yeah, that's right. I often say we're trying to help kids who have impulse control problems get to the point where they can say, yeah, this would be cool to do, but it's also dumber than it is cool. That's what we're trying to, that's sort of one of my goals, you know, we're trying to help people with impulsivity problems. So now the more routine kind of hyperactivity that you tend to hear about, think about is trouble waiting on things, you know, they want it right now, and have difficulty deferring gratification. They may have sort of too much focus on the right now and not on the future. We usually think of kind of excessive movement, you know, moving around too much, having trouble sitting still, being fidgety, and so forth. So inattention, impulsivity. And then the last, all I'm going to say about emotional regulation, I'm going to have to move along here, is this is new to most people. And the way I like to think of this is we all express our happy emotions and maybe our negative emotions. We get excited, or we get mad, or we get sad. And now we think, most of us though, when we have emotions like that, we kind of govern our emotions. We put some limits on them, you know? So we might, if we're at work, I might say, man, I'm really mad at my boss right now. But I control those emotions enough to not lose my job while like slapping somebody like the boss. And it'd be really uncool if I did that. My boss is a Catholic priest. Popping him one across the face probably wouldn't be a good idea. But so we do that all the time. And but we think that kids with ADHD as a group, even if they're happy, they have trouble kind of putting a lid on it. Everybody comes back at school from the field trip. Everybody's excited. It was a cool field trip. And the kid with ADHD may be the last one to settle down for his excitement. Or they may be quicker to get angry, or quicker to get sad, quicker to cry, quicker to laugh. All that emotional impulsivity we think is increasingly something to think about. I'm skipping a little bit. Y'all will have my slides. Let's talk a little about treatment. I'm not going to go into a lot of detail on treatment. What I've given you, by the way, is a fairly recent summary. It's a little bit technical, won't be for all of you, but it's basically what we know now are kind of the best supported approaches to treating ADHD. But before I say a little bit more about treatment, just a reminder that one of the reasons I've told those kind of stories, one which is kind of funny, one is not funny, is that we sometimes understandably are really reluctant to see our children labeled, you know, with a diagnosis like ADHD. But I think an honest review of the situation would tell us that can do a real disservice to the child. We're trying to do the right thing by not getting labeled, but if not getting them labeled means they don't get the help they need, then it can have some pretty serious consequences for that child, you know. And just a short version of this, we now know that ADHD untreated, particularly, pardon me, is a common reason for people to be disabled, actually. There's more I can say about that. Unintentional injuries. I just mentioned my story about the guy who broke his leg. Now, I'll tell you another one that's just as serious as it can be. One of the talks I've been giving for 25 years is on motor vehicle crashes and teenagers. My parenting teen drivers is the thing I do. A 16, just a regular 16-year-old, whatever that looks like, a 16-year-old is four times more likely than we are to be in a motor vehicle crash this year, okay? So that's a big deal. That's why motor vehicle crashes are still the #1 killer of teenagers. So that's a regular 16-year-old. A 16-year-old with ADD, pardon me, is 3 times more likely than his peers to be in a car wreck. And that's serious. Sorry. So we're ramping up. We're ramping up their #1. No, I'm just helpless. I can't do it. We're ramping up the #1 cause of the death of teenagers by a factor of at least 3 if they have ADHD. So that's serious. It can cause all kinds of academic problems. It can cause vocational problems. It can contribute to substance abuse. A couple of ways. People sometimes develop trouble with substance abuse by being impulsive and sometimes by self-medicating. So that's in there. I wish I had time to give a long talk for y'all about what we now know about all kinds of health problems that we think are made worse by ADHD, because taking care of your health requires some focus, some discipline, not being distracted, and some of the things that tend to be weaker with people with ADHD. As an example of that, diabetes and heart disease rates are higher in people with ADHD. So there's more about this I could go into. So you've got this thing about best evidence. In my opinion, and this has been my opinion for a long time, every child with ADHD deserves to be evaluated for medication. If you quote me as saying that every child with ADHD should be on medication, it's not what I said. What I said is they ought to be evaluated for it. They deserve that. We have more research studies on the use of those medications than we do any other medication in pediatrics. Let me say that again. There are no medications given to children that have more research done on them than medicines for ADHD. And what that research adds up to is that they are relatively safe and relatively effective. Now, some of you said, okay, Dale, you tried to pull a fast one there. You said relatively safe. Y'all, Tylenol is relatively safe, right? Antihistamines, relatively safe, relatively effective. In fact, a big study just came out, and you see this, that said that nasal decongestants don't work. And most of us said, oh yeah, newsflash. Right? I've been taking them for years when they're not working, right? So no medication is 100% safe or 100% effective, but the medicines for ADHD are relatively safe and relatively effective. An informal way I put this to people, it's informal, but I'll say it anyway, is I have 4 grandkids. If one of my grandkids has ADHD and ends up on medication, I won't lose any sleep, none. In fact, I'll sleep better. Parents often have worries about medication. And some of these are actually all of them are perfectly fair, but they're often based on misinformation. Stimulants don't accumulate, Adderall, Ritalin, Focalin, all of those. Most of the medicines that are used are stimulants, there are a few exceptions. They don't accumulate in the body, period. So if I loaded up a big Concerta right now and took it, Concerta, the active ingredient is basically Ritalin, methylphenidate, with a slow release to it. If I took a time-release Concerta right now, by late tonight, it's out of my system. It's excreted out the kidneys very efficiently. So it's, in that sense, stimulants, I like to think of them as kind of like aspirin, where you take it, it starts working, if you're lucky, in 20 or 30 minutes. It works for a few hours, and then it quits working, right? So there's nothing that lingers here, and that's hugely important, because if you're worried about a side effect, and so your doctor puts your child on Focalin, I'm making this up, and he has side effects. And a week later, you say, he just won't sleep or whatever it is. And your doctor says, well, quit giving it to him. He's going to be back to his normal state easily in 24 hours. There's no, long-term side effects have just not been documented. And I would tell you that in 25 years of seeing these patients, and another, what I'm up to, 15 years of doing a lot of education on this, I have never had anybody come up to me and tell me a horror story about medicine. I've heard stories about them not working, causing side effects that were bothersome, but not permanent damage of any kind, right? So I think that's a built-in safety factor. People are worried that their child's personality will change. Well, the fair part about that is sometimes if a child's taking a stimulant, particularly if it's a little bit too much, it will kind of flatten their demeanor while it's in their system, but not the next day unless they take it again. That's a temporary effect of medication. Or my child will be like a zombie. This is a zombie. This is a child zombie. That's not what this is. So it's more of this kind of, it's almost like the medicine's working too well. Like, that's the most fascinating doorknob I've ever seen. And you back off a little bit from the dose, and sometimes it'll go away. It's generally not a big issue. So weight and growth issues, very complicated. But I think the short version of like the stunning growth thing is that there is a subset, there may be a subset of people who take stimulants for a long time who may end up being shorter than they would have otherwise by maybe an inch or so. We're not talking about somebody who's genetically supposed to be 6 feet tall and ends up being 5'3". Nobody talks about that. It can be a subtle change, and it's usually something your doctor can work with. Another thing to remember, I'm trying to jam all this in, is this is understandable too, but people get confused. Like, once I agree to have my child on medication, then I've made a lifelong commitment. If you decide to try your child on medication, you're making a commitment for a week, right? You can always decide. Sometimes I think what people are afraid of is the medicine will really work well. And then they feel like, okay, I'm going to have my child on medication, But all of those worries, let me sum this up. All of those understandable worries we have about something that might be a problem with medication, all that has to be balanced against what we know about ADD and what it can do to people if they're not treated. And we don't have other treatments. We have other treatments that may help some, but honestly, we just don't have treatments that are as broadly effective and robust as medication. I wish that weren't true. In all the years I practiced, I couldn't prescribe because I don't have any vested interest in it. I have a vested interest in counseling and psychotherapy. That's what I did for a living. It just turns out that counseling and psychotherapy can't adequately treat ADHD. Medication can. But it's scary and it's understandable, and it's something people ought to think through and do research on. Okay, so medication. Another big one is sort of patient education, parent education. I wanted my kids that I saw in therapy who had ADHD to understand they had it and what it meant. I didn't want my 7-year-old patients thinking the medicine they take in the morning for ADHD is really a vitamin. It's their lives. It's just a matter of human dignity. I think they deserve to have some understanding of what's going on with it. And then the other thing, which y'all are all here, and I talked about being excited if you're here, is the patient education piece, the parent education piece. Just knowing more about the disorder is essential. And actually, sadly, the vast majority of parents of kids with ADHD get almost none. The doctor's busy, says, let's try them on Focalin or whatever it is, and you don't ever really get a chance to get that kind of understanding. I do a 3-part series on ADHD for parents. Each episode's 90 minutes. And that doesn't feel like it's enough, really, for people who really want to do deep diving. I'll give you some suggestions in a second about how to get a little deeper. Let me do that now. This is still my favorite all-around book, and there's some really good ones. but this is Russ Barkley's Taking Charge of ADHD. It's still my general overall my favorite book by a guy who's sort of probably the most nationally known figure in doing research on ADHD. I want to advise people, I get in trouble for this all the time, I don't mind. I've got, like I said, I've got a Medicare card. I'm going to be all right if I lose my job. Don't spank children with ADHD. I had a lot of reasons for saying this. One is I think in 2023 it's time to stop hitting children. Children are the last people who we're allowed to hit in the United States. You ever think about that? You can't hit your spouse, you can't hit your boss, you can't hit a stranger in a bar or insult your wife. You can't hit anybody. You can't, but we still can hit children. But even more than that, there is zero evidence that it's effective for children with ADHD. And the evidence that it is harmful to spank children with ADHD is accumulating. So I just flatly advise against it. There are things that work better. The problem a lot of people have is the things that work better are harder. Take more time, more effort, more concentration, more focus, than swat the kid on the hiney with a wooden spoon or whatever. This is not the reality. I know it seems sometimes like, ooh, let me check my to-do list. Make mom and dad miserable today, right? Everybody giggles at this, and that's why it's here. But it's also there's real truth to that, right? Because it does seem sometimes like, why is this child trying to make me miserable? And they're not trying to. That's not the goal. There's a psychologist named Ross Greene, who I heard speak a couple times, and Ross Greene said something in this talk I will never forget. It was an example. This kind of thing happens to me all the time. Somebody will say something profoundly obvious, and I'll go, he said, children do well when they can. And I couldn't eat lunch. I was so blown. I couldn't, look at me. I couldn't eat lunch. Because what he was really saying is we tend to make moral judgments when kids don't do well. They're lazy, they're unmotivated, whatever it is, without eliminating all the things that may mean they can't do as well as we like for them to do. How behind am I? How far behind am I?
You are 8:46.
It's been worse, right? I'd be worried if it was 1:30 in the afternoon. Okay. Is there a role for mental health care? Yes. So let me just take a second. A child with ADHD will not be fixed by conversations with therapists. They won't be fixed by a play therapist. They may be able to feel better about themselves, maybe understand their disorder better, maybe not be down on themselves so much, because Jeff's over here looking at the kid next to him, and why is it always me? There's a lot of potential benefits from having a good counselor for this. Also some benefits for having, say, a child psychologist who can work with the family to help figure out how to do maybe sort of discipline more effectively or whatever it is, as long as we don't think of it as something that's going to cure them. It's not like one day they're going to be laying on the couch with the ceiling and say, oh, this dream tells me how I really feel about, my mama, and then they're going to walk out there paying attention. But it certainly can be helpful. But let me just make this plea to you, and you may have to kind of fight for this, to be honest. I believe if your child has ADHD, they ought to see a qualified mental health professional regularly, not necessarily frequently, no matter how well they're doing. I feel very strongly about this. And to be honest, a lot of my colleagues don't feel that way. They'll sort of say to you, he seems to be doing well in school, the concern is helping him, call me if you need me or make an appointment. I object to that practice. If you work with me, and I'm retired from seeing patients, I don't have any vested interest in this, but I used to say to parents, he seems to be doing great. So I will see you back. I'd like to see you back in 4 months or 3 months or 6 months. There's a lot of reasons for that. But one of the main reasons is, let's say my patient was your child, 10 years old, seems to be doing well, taking medication, doing some time out at home, to kind of structure things better. Everything seems to be working pretty well. Why do I want to see him again? Why do I want to see him like for checkups? Because one thing we know about ADHD is it tends to cause complications during the teenage years, including things like depression. And depression is super serious, right? We have ramping up levels of anxiety, depression in teenagers and children. The suicide rate is going like this. After years of going down, people don't know this, suicide rates among teenagers were dropping steadily until about 7 or 8 years ago. They've been going up again. So y'all know this, we're in a mental health crisis. So let's say your 10-year-old is doing great. And then I'm seeing him, let's just say I'm seeing him twice a year, and he's doing great. And then at 14, he gets a depression, and he feels terrible. And you call me and you'll say, Dr. Wesley, Kyle's doing terribly. I'll say, I'll see him Friday. And I'll know him, and he'll know me, and we'll have enough of a relationship, hopefully, that we can kind of pick up and work together. As opposed to, your child is not being seen anybody, a depression hits them. Y'all have a feel yet for how long it takes to get in to see somebody in this town? Even in Birmingham, that's a qualified, I don't want to go into that rant. I'll tell you this, I'm about to go into this rant. I'm serious. This is driving me slap crazy. I don't know what the problem is or what the answer is. It's a supply and demand problem, in that the demand for mental health services for children is going like this, as no one knows, anybody, as y'all know, and the supply is not going up. In fact, a bunch of us old farts are retiring out of it and not being replaced by anybody. And that, y'all, is in Birmingham, Alabama, where I used to work in Mountain Brook, and people call me all the time and say, Dale, I can't find anybody. Hell, in Mountain Brook, you can walk to UAB. And your next door neighbor is a pediatric surgeon, and whatever it is, and we still can't get these kids given. Y'all, this is a scandal, and it's with potentially deadly consequences for a lot of our kids. We are failing our children. It's not anybody's fault. I mean, nobody's sitting around deciding to strangle the mental health system. And then again, if it's so bad here over the mountain, what about these 4 people west of Montgomery where she works at a nursing home and he works at the tire plant? And even if they could find a doctor in Birmingham, you think they can both take a day off from work every 2 weeks to drive to Birmingham? This is wrong. And so last snotty remark about this, if I was emperor, and let's all be relieved that I'm not, I would bulldoze the entire mental health system for children as it exists now, and I would put it at this school. And every school in North America would have one person at least on their staff that did nothing else other than take care of the mental health needs of kids, and they need to be qualified to do it. And yes, we can afford it. Do not let a politician look you in the eye and say that you can't afford to do that. You can afford to have a psychologist in every school in Alabama. Why have it in school? That is where the children are, right? And where there are all kinds of things that, I'm obsessed with access to care. It's one thing, that this medical care for adults isn't amenable to all of us, but the fact that we're doing this for our children is unforgivable. Thank you for letting me rant. I see my blood pressure now. I don't feel good. Tired, sleep deprived, jet lag. Anyway, thanks. Okay, another complication. At least 70%, maybe higher, of kids who have ADHD are going to have another diagnosis. And these are, I'm sorry to go into numbers geek mode. These are boys and girls, blue and gold. And the prevalence, the chances they'll be diagnosed with something else if they have ADHD. First label there, that was squint, even though I wrote it, oppositional defiant disorder, which I summarize as you say tomato, they say tomato, no matter what it is. Enuresis, which is bedwetting. Major depression, potentially life-threatening disorder, right? Look at the differences. Look how likely it is for a boy, for example, to have it, and it's unacceptably high for girls. Anxiety disorders, the next one, it says 28% and 33%. Conduct disorder, serious behavior problems in their teenagers is a short version of that. And then bipolar disorder, which is manic depressive illness, but that's complicated in a way we don't need to get into. Let me just bear with me. Just one more thing. I always promise that, then there are 8 more things. But so I'm just really touched by this study, and it came out some years ago now, not that long ago, 2016. But just to orient you to the graph there, first column is the co-occurring disorder they looked at. This is just girls. They're just looking at girls. The disorder they might have in addition to ADD, and then the percentages. So just take a quick look at that, and you'll see the differences between ADHD girls and non-ADHD girls. But what really touched me was this little paragraph. I'm going to read this to you. Girls with attention deficit disorder are at higher risk than girls without ADHD from multiple mental disorders that often lead to cascading problems such as abusive relationships, teenage pregnancies, poor grades, and drug abuse. And what touched me there was the word cascading. That sometimes ADHD, okay, big deal. Trouble paying attention in math class, maybe somewhat hyperactive, could be so much worse, and often is. So the academic problems snowball, the social problems snowball, the self-concept becomes a problem. In these kind of worst case scenarios, and these problems just start to pile up in the lives of, but in this case, these young women. But this exactly is the same kind of dynamic plays out with boys. And again, I'm not trying, there are many, many success stories of people who have ADHD. People that are professional, people that are happy, and I'm talking about the things that can go wrong when the more significant, the more serious the disorder is, the more this is a problem, and the less treatment intervention kids get, the more these kinds of things are a problem. So that should try to keep us all motivated to not be too passive, to be willing to be kind of aggressive in seeking out care and making sure you stay on top of it. That's my motive for all that. So I hope, the thing about this is ADHD is not just a person who has trouble paying attention, who may or may not be hyperactive. There we go. I'm going to stop and see what kind of questions you have. Always takes a second for somebody to break the ice, but somebody will.
I have a question.
Yeah.
I've been seeing a lot advertising about supplements for kids.
Yeah.
Have you read any studies? Are there any studies? What do you feel about them?
Here's what I think, and I try to make what I think based on what I know about the research. And if instead I'm talking about clinical experience, I'll tell you that too. I think there's enough evidence that it may be I'm piling on a lot of sums here. Some children may be somewhat helped some of the time by omega-3 fatty acids. But every time I look at the research, it looks like that kind of flips. I don't think that's quite settled down. Somebody here may know better than I do. I don't think there's any particular danger, particularly if you're addressing omega-3 fatty acids in salmon and staying away from it. There's probably enough of that using my grandkids example, what would I do? I'd probably say try to get some fish oil in. Camphor might be somewhat helpful. The other stuff people sell, I think the data are absent or poor for those. And I would include in that any kind of dietary approach. Stop giving them this, stop giving them that. I just don't, both the research and my clinical experiences, I don't find, and of course, to the added danger of people doing too many of those kinds of things, and they lose time and avoid doing things that we know are helpful. I don't have like a categorical objection to alternative treatments, just some of them I do. If they can take people's money from them in a way that I don't think is appropriate, but just I always ask people, don't waste too much time. It's kind of a loaded way of putting it. Don't spend too much time on that and avoid other things. It's a great question. Yes?
So your first example of the kid who comes on Sunday evening and has the project that's due the next day, and I have definitely been to how many times have I told you to hear it?
Yeah.
What is a better response?
Okay, yeah, it's great. So at the risk of a cliche, the best response is prevention. Okay? So the prevention in this case is once you know that part of the disorder is your child having trouble not only maintaining a schedule, but understanding what a schedule is, right? Once you recognize that, then a parent's more likely to say, okay, let's get out and see what your assignments are looking like, what's the calendar going to be. I love to tell this story. Don's heard me tell it a zillion times. A teacher whose classroom I visited in Shelby County 25 years ago. And she asked for kids in her classroom that had ADHD, which I thought was impressive. And her classroom had a strip of paper that went from the door all the way around the classroom and ended at the door again, like that wallpaper stuff at the top, they used to sell. And it was a calendar. So at the beginning of the day, she would say, okay, here we are, it's September 21st. And look, coming up here, Halloween is so many days. And tomorrow we're going to have a little lesson on so-and-so, and then we got the field trip and so forth. And she would kind of guide kids through the timeline. And I thought that was the most genius thing ever. Because I think just intuitively, I don't know if there's any studies out, but she was helping those kids develop a way of kind of seeing time passing and knowing you got to arrange things. So that's how parents, ideally, parents and teachers collaborate on parents being informed and trying to keep up with what's due and when's it due. And I think a lot of schools do really well at that. But I think that's the idea. When it happens, then instead of saying how many times I told you, which it's kind of, I love this one. Let's do a show of hands. I just love to do this one. How many of you ever said to your child, what were you thinking? Just go ahead with your answer. Right. Okay, thank you. How many of you have ever gotten a satisfactory answer to that question? Which makes you want to ask, why are we asking? Why are we asking it? And with ADHD, there's sort of an absence of thinking in terms of planning and so forth. So instead it's, okay, let's go through what's happened here after you get the map of Western Europe done. The next day, after everybody's calmed down, let's go over what happened. Looks like we had some kind of mishap in scheduling. It caused some inconvenience and some stress in our family because we had to make this run and do the map. So you then keep doing that in a dogged sort of way where you go back and revisit it. There's no particular value to being punishing or judgmental about it. It's a little bit like taking some feature of a disabling condition and fussing at somebody about it. You just support different ways of approaching it next time. Great question. Yes?
I've got a 6-year-old that has.
That's your problem right there.
ADHD.
6-year-old, right?
Yes, I know. He's combination type severe. So he is on medication. They've recommended behavioral therapy.
Yeah.
Would behavioral therapy be beneficial at 6 years old?
Yeah, oh, yes. For sure, yeah. And depending on the problem, it could be helpful from age 3.
Okay.
But depending on the sort of things you're dealing with, but for sure 6, yeah. And one of the reasons I like that book, that book that I showed you earlier, Barkley's book, he has chapters in there that kind of walk you through how to do some of this stuff. And then there's by the same team of people, including Russ Barkley, there's a book called, Your Defiant Child, which is a terrible name for it. It's not really what it's about. The publishers do that to authors. And another one called Your Defiant Teen. And it's really about how to do timeout, how to do things like behavioral contracts. And it's like a workbook. It's just super. And I've used it over the years many times to teach parents how to do different kind of methods. But absolutely, sure can. Who else? Yeah.
Okay, so if we walk through the process of the Vanderbilt assessment.
Yeah.
And we are not seeing those behaviors at home.
Okay.
We are not seeing those behaviors at school.
Oh, neither one.
I'm sorry, at home or in sports, only at school.
Right.
And so you take these to the pediatrician because they get the parents to evaluate, they get multiple teachers to evaluate,
Yeah.
and you've got 3 of the 4 evaluations that are not showing it. You've got one that is.
Yeah.
And the pediatrician's like, well, we really like to see it in more than one area to get that diagnosis.
Okay.
But that's very contradictory to, especially if it's something they don't enjoy, the quality of the activity matter.
Yeah, that's
To have
right.
a boy, sports, we are laser focused.
Yes.
And have no issues.
Yes.
The school work.
You're right. Did everybody understand the question? Okay, so that's an extremely common problem, by the way. City constellation to you. Happens a lot. And when I have sometimes get a chance to speak to pediatricians about this very issue in training sessions, and I really recommend reconsidering that approach of having to have evidence of it in more than one setting, particularly when the setting you do see it in is at school. You can have it, let's say that you've got a case where, let's just say God knows they have ADHD, right? You could see evidence of that at school, but because of sort of lifestyle issues, personality issues, it's just not that big of a whoop. That's a clinical term, by the way. Not that big of a whoop at home. And just for the reason you cite, if the child just loves the sports thing and has, by the way, a really good motivating coach that does really well with them, they might be just fine. So I think when a pediatrician says, we really need to see more than that, I can spare a pushback a little bit. And go back later, we'll continue to have problems. I'm not going to be upset with the pediatrician if they do that initially, but if they maintain that approach, then I'd have a problem. I'd have to just take them out here and just whip their butts, is what I want to do. I'm sorry. Who else?
So
Yes, sir.
along that same vein, can you
Yeah.
talk about diagnosis, like filling out forms versus a computerized assessment? TOVA.
Yeah. So there are people use different kinds of methods to arrive at a diagnosis, and there are now some computer-based assessment things that can be very helpful sources of data. But I'm a big proponent for not relying on any single source of data. The art of a good diagnosis is collecting different kinds of information from different sources. So computer assessment can be part of that, but in my opinion, if a psychologist says, this score on the computer test is too low for the evaluation, or for the diagnosis, and they stop there, they're not doing their job, in my opinion. Furthermore, if they say, well, we see it on this thing, the computer system, but nowhere else, that's kind of flip of the problem. The art, to me, of the diagnosis, you gather all that information together, and then you make your best shot at a diagnosis. The way I used to put this is, I'm a big advocate of history and interview, right? Getting the information from people. So the way I used to put this is, I'm an expert on the disorder. You're an expert on your child. Let's compare notes, right? And see how much what you know and your child's teachers know, and see how that matches up to the diagnosis. Now, the indispensable, in my opinion, the indispensable things you have to have for a good evaluation is a good history, knowing what's going on, and information from the school. Because the schools are in a position to see things I cannot see sitting in my office. And so psychologists rely heavily on teacher feedback. And it's like anything else, that's a piece of it, but it is, to me, a critical piece, those two things. Other things you add can be helpful, but those two are indispensable. There are some physicians who will do a DNA test with the idea that it may help the clinician predict which medication they may respond to more. Some of this I'm having to rely on my memory. The first time I saw that, it was really about antidepressants for people with depression. The idea was, this might be a better antidepressant than this one based on DNA. I have less experience with this approach to ADHD. The last time I looked at it, it wasn't as well developed as the one for antidepressants. And the other reason, I think the cost has come way down. So I don't think there's a big downside to it, right? But I think if somebody says to you, I've got to have this to know which medication to start with, I'm skeptical about the approach. And partly because, look, so let's say we were working together on this and I'd say, let's start off with Adderall. Well, not Adderall, because there's no Adderall left in North America, but let's try Concerta. And so let's say it doesn't work. We're probably going to know in a week whether it's going to work. And then we can immediately stop a medicine doesn't work and start another one the next day. You can't do that with antidepressants. It takes longer to know if they're going to work, and then it takes longer to make the change, and you're dealing with major depression. You just can't afford that. You know, those longer approaches. So that's why I'd be much more prone to say to a friend of mine, yeah, if they offer you a test for antidepressant, go for it. It can't hurt. It might help move things along. With medicines for ADHD, you've got a different approach you can take, knowing it doesn't take very long to try one and move on to the next one. So back when it was a lot more expensive, I was more like, I guess the other way I would put it is, and I don't mean to sound like an old part that I am, is we saw a scad-zillion kids with ADHD for 25 years before that became available. We somehow managed, So if it's inexpensive, I wouldn't discourage it, but I'm a little skeptical of the approach. I can't possibly decide where to go with this once I see lab results. And we'll do one more. We have time for one more yet. You jumped in there, get that one.
I know you're talking about omega-3 maybe being beneficial. Are there certain things that these kiddos should definitely avoid dietary-wise? Like I've heard red 40 potentially.
Yeah, so there's a little bit of this where we probably could afford to do a little bit of consideration of the research, but also, if a parent says to me, it just seems to me like every time he gets a big load of sugar, it makes things worse. Okay, so the data really suggests that there's no relationship between sugar and ADHD symptoms. But if a parent, a lot of times research you're looking at 1,000 kids and you're squashing out individual responses. So I've had parents before say, Dr. Wisely, I know that every time this kid eats something red, it gets worse. I say, then don't give him anything red. It's kind of, now where I kind of personally draw the line is there are some diets that get advertised as ADHD diets that are based on where they give kids ridiculously few foods. There are studies in Europe that are supposedly an ADHD diet where a child can eat lamb, rice. I mean, it's like this. I call it the child abuse diet. And I make that joke, but at some point you have to say, how they used to kind of do this diet for 30 years ago that was 100% all natural, no preservatives, no processed foods. Basically, that one I used to call the Little House on the Prairie diet, right? Okay, who can do that? do that. And you're going to spend all your time in the kitchen trying to scrounge up all natural stuff, when it might be a lot more beneficial to spend time playing with the kid or interacting with the kid. So I'm more than a little skeptical about dietary approaches. Yeah. Y'all have been awesome. Thank you so much. I hope I can come back and see you another time. Thanks. Thanks for being here.